Have you ever stopped to think about what happens inside your body in the first 5 minutes after you wake up? Most people wake up, shuffle to the bathroom, head straight to the kitchen, and pour themselves a hot cup of coffee. It feels like the perfect way to start the day. It feels like a reward. It feels harmless. But here is what nobody tells you. That cup of coffee, before a single drop of water has touched your lips, may be silently pushing your blood sugar higher every single morning. And the worst part? The fix is so simple, so cheap, and so close to you right now that you will wonder why no doctor ever sat down and explained this to you before. Stay with me until the very end of this video, because what you are going to learn today could change your next blood sugar test. For real. But before we dive in, let me introduce myself. I am Dr. Santiago Garcia. I have been a family physician for over 25 years, specializing in the health of adults and seniors. Throughout my career, I have worked with thousands of patients who struggled every single day to keep their blood sugar under control. And I have learned that the most powerful solutions are almost always the simplest ones. And I would love to know, which city or state are you watching from right now? Drop it in the comments below. It truly makes me happy to know where each and every one of you is joining me from, because you are the reason I keep showing up here. Now, let us get started. Today, I want to talk to you about something that seems almost too simple to matter. Water. Not medication, not a special diet. Water. I already know what you might be thinking. Dr. Santiago, I know I need to drink water. And I believe you. But what I am going to show you today is not about how much water you drink. It is about how and when you drink it. And that difference changes absolutely everything. Let me tell you about Mr. Harold, 74 years old, a retired school bus driver from a small town. He came into my office holding his lab results, his hemoglobin A1C, which measures the average blood sugar over the past 3 months, sitting at 8.9%, a number that concerned me deeply. He was taking his medication on time, every day. He had cut out white bread, sweets, and soda. He walked every morning around the block, but his blood sugar simply would not come down. When I asked him about his morning routine, he leaned back and said, "Doc, I wake up, use the restroom, and go straight for the coffee. Water? I only drink it when I get thirsty." Right there was the answer. Here is something most people do not know. Our bodies are made up of roughly 60% water. That means in a person who weighs 155 pounds, over 90 pounds of their body weight is water. Water inside the cells, in the blood, in the organs, in the muscles. When that water level drops, even just a little, the entire body shifts its behavior. And here is the part that surprises almost everyone. There is a hormone in your body called vasopressin. You can think of it as the thirst hormone. When your body senses that your water levels are low, it releases this hormone to hold on to fluid. But that same hormone does something else at the exact same time. It signals the liver to release sugar into the bloodstream. Do you see the problem? You did not eat anything wrong, but your liver is dumping sugar into your blood simply because your body is thirsty. A study conducted in France followed more than 3,600 people over 9 years and found that those who drank less than 1 liter of water per day had a significantly higher risk of developing type 2 diabetes, exactly because of this mechanism. So the question is not, am I drinking enough water? The real question is, am I drinking water at the right time and in the right way? That is exactly what you are going to learn today. And coming up in just a few minutes, I am going to share with you the morning ritual that my patients describe as the single simplest and most effective change they have ever made. And it costs absolutely nothing. Before I give you the full protocol, I need to walk you through 3 very common mistakes I see every single week in my practice. And honestly, I would bet that you are making at least one of them right now. Mistake number 1, drinking water only when you feel thirsty. It sounds perfectly logical, right? Feel thirsty, drink water. But here is the problem. Thirst is like that red warning light on your car dashboard that turns on when the fuel tank is almost empty. By the time it appears, the problem has already started. When your mouth feels dry and your throat is asking for water, your body has already lost around 2% of the water it needs. For a young and healthy person, that is just a minor discomfort. But for someone trying to manage their blood sugar, especially after the age of 60, that moment is already too late. And here is what makes it even more complicated. After the age of 55 or 60, The thirst mechanism in our brain becomes slower and less sensitive. It takes longer to send the signal. You could be significantly dehydrated and feel absolutely nothing. Your body has quietly stopped warning you properly, which means you need to drink water before you feel thirsty, proactively, as a deliberate daily habit. Mistake number 2, drinking too much water all at once. Some people go the entire morning without drinking anything and then, out of guilt, gulp down a huge glass of water right before lunch, thinking they are making up for lost time. That is not how it works. Imagine you have a potted plant that has been dry for days. If you pour an entire bucket of water all at once, what happens? The soil hardens, the water runs right over the edge of the pot, and the roots, deep down, stay thirsty anyway. The same thing happens in your body. Your intestines can absorb roughly 200 to 250 milliliters of water every 15 minutes. Anything beyond that goes straight to the bladder and is eliminated before it can benefit a single cell in your body. Hydration needs to be slow, steady, and spread throughout the day. Small sips, many times. Mistake number 3, drinking ice-cold water. This one surprises almost everyone. On a hot day, nothing seems more refreshing than a tall glass of ice-cold water straight from the freezer. I completely understand. But for someone with insulin resistance or diabetes, that habit can create an invisible obstacle. When ice-cold water enters the body, the blood vessels constrict. They narrow, like a garden hose that you squeeze in the middle. Circulation becomes more difficult. And insulin, which already has a hard time reaching the cells, faces even more resistance along the way. Think of it this way. Insulin is like a delivery driver that needs to travel through the roads of your body to bring glucose to the cells. Ice-cold water narrows those roads. The driver gets stuck in traffic. Sugar keeps circulating in the blood for longer than it should. The ideal temperature is room temperature water or slightly warm, somewhere between 72 and 76 degrees Fahrenheit. That's simple. And just that one adjustment, swapping ice-cold water for room temperature water, can already improve the way your body responds to insulin, without spending a single extra dollar. Now we are getting to the part you have been waiting for. I call this the 4 pillars of smart hydration. It is the same step-by-step approach I walk my patients through every day. It requires no extra spending. It does not replace any medication. But it can powerfully support everything you are already doing. Let us go through each one. Pillar 1. The morning ritual. This is the most important one of all. Pay close attention. When you wake up, your body has gone 6 to 8 hours without a single drop of fluid. Your blood has become more concentrated, like a pot of chicken broth left in the refrigerator overnight that thickens up. That thirst hormone I mentioned, vasopressin, is at its peak, and blood sugar tends to rise in the early morning hours, partly because of this, but there is a golden window right after you wake up. In the first few minutes after opening your eyes, insulin sensitivity, meaning your cell's ability to absorb sugar and use it as energy, is at its highest point of the entire day. If you take advantage of that window to hydrate well, you set your body up for a much more balanced day ahead. Here is the instruction. Before anything else, before the coffee, before breakfast, before picking up your phone, drink 1 glass of warm water, around 10 to 12 ounces. Add a very small pinch of unrefined sea salt, coarse sea salt, pink Himalayan salt, or any natural unprocessed salt. Why the salt? Because that natural salt contains sodium, potassium, and magnesium in natural balance. Those minerals signal to your body's glands that the day is off to a calm and stable start. And that helps reduce the morning spike of cortisol, the stress hormone. And cortisol, when it rises high in the morning, signals the liver to release stored sugar into the blood, even before you have eaten a single thing. This ritual, 1 glass of warm water with a tiny pinch of salt, is the simplest, most affordable, and most powerful way to begin your day with your blood sugar working in your favor. Remember Mr. Harold I mentioned earlier? In 3 months, by changing only this one morning ritual, his hemoglobin A1C dropped from 8.9% all the way down to 7.3%. Same medication, same morning walk. The only thing that changed was the water. Pillar 2. Water before meals. This one is so simple it almost feels like it cannot work, but it does. 15 minutes before each main meal, breakfast, lunch, and dinner, drink a small glass of water, about 5 ounces. Not during the meal, not after, before. Why? Because that small glass of water activates digestive enzymes and gently dilutes the stomach environment. And that causes the sugar from your food to enter the bloodstream much more slowly and smoothly. Think of it this way. Imagine you are pouring a full packet of sugar into a glass of water. If you dump it all in at once, it sinks straight to the bottom in one big rush. But if you add it gradually and stir gently, it dissolves little by little in a calm and even way. That is exactly what happens with glucose when you hydrate before eating. It enters the blood gradually, without causing that sudden spike that overwhelms the pancreas and leaves you exhausted after meals. And in the next pillar, I am going to share a special trick using a spice that most people already have in their kitchen cabinet, one that can help your body use insulin much more effectively during physical activity. Pillar 3. Hydration. During movement. When you go for a walk, work in the garden, climb a flight of stairs, or do any kind of activity, even a gentle one, your muscles are using glucose as fuel. It is one of the best moments for your blood sugar to come down naturally. But for that to work properly, your body needs to be well hydrated. The guidance I give my patients is this. Every 15 minutes of activity, take 3 to 4 ounces of water. Small sips. Do not wait until you finish. Do not wait for thirst. And here is that special trick I promised. If your doctor approves, add a small pinch of cinnamon powder to your water bottle during exercise. Cinnamon is a natural insulin sensitizer. It helps to open the doors of your cells so that glucose can enter more easily, like a key that makes the lock work better. Research shows that cinnamon can improve the way cells respond to insulin, especially in people with prediabetes and type 2 diabetes. It is safe, inexpensive, and sitting in most people's kitchen cabinets right now. And during exercise, the effect is even more pronounced. A small bottle of warm water with a pinch of cinnamon during your morning walk. That simple detail can make a real difference on your next lab results. Before we move to the fourth and final pillar, the one that surprises people the most and has everything to do with what happens inside your body while you sleep, I need to ask you a favor from the bottom of my heart. If what you are learning here is making sense to you, if you feel that this information could help someone you love, please hit the like button right now. And if you have not subscribed to the channel yet, go ahead and subscribe and turn on the notification bell. Here is why that matters so much. YouTube works as a recommendation system. The more people like and interact with a video, the more YouTube understands that the content is valuable and starts showing it to more people who need exactly this kind of information. There are so many people out there, alone and confused, unable to understand why their blood sugar will not come down despite everything they have tried. This video can reach them, but only if you help me right now. And in the comments, tell me, did you already know any of what I have shared with you so far? Type, knew it, or never knew. I genuinely love reading your responses. Now, the fourth pillar. Pillar 4, the nighttime glass. This is the one that surprises people the most, and it is all about what happens while you sleep. Many people come into my office worried about their fasting blood sugar. That number you measure first thing in the morning before eating anything. And that number often comes back high for no clear reason. You did not eat anything wrong the night before. You went to bed with your sugar under control, and by morning, the number went up. Why does that happen? Because while you sleep, your body keeps working. It repairs cells, regulates hormones, and processes everything you ate during the day. But if your body runs low on water and minerals during the night, it goes into alarm mode. It releases stress hormones, and those stress hormones tell the liver to release glucose. That is why so many people wake up with high blood sugar without understanding why. The solution is simple and comforting. About 20 minutes before bed, drink around 8 ounces of warm water. And if your doctor approves, consider adding a dose of magnesium to that water, around 200 milligrams in the form of magnesium citrate or bisglycinate, which are the forms most easily absorbed by the body. Magnesium is a mineral involved in more than 300 processes in our bodies, and people with diabetes tend to have significantly lower magnesium levels than the general population. A review that analyzed 13 randomized clinical trials confirmed that correcting this deficiency significantly reduced fasting blood glucose levels. But please remember, before taking any supplement, always speak with your doctor first. This is not just a formality. It is because every situation is different, and your doctor needs to evaluate what makes sense for you specifically. The warm glass of water before bed. That simple gesture may be the explanation for that mysterious high blood sugar reading you see every single morning. Now, I know the question that is forming in your mind right now. Dr. Santiago, how much water do I actually need to drink each day? Forget the 8 glasses rule. That number was created decades ago, in a completely generic way, without considering body weight, age, activity level, or climate. The formula I use in my practice is simpler and more accurate. Take your weight in pounds and multiply by 0.5. That gives you the number of ounces of water your body needs per day. If you weigh 140 pounds, 140 times 0.5 equals 70 ounces, just under 9 cups. If you weigh 180 pounds, 180 times 0.5 equals 90 ounces, just over 11 cups. If you do any physical activity, add another 12 to 16 ounces for every hour of walking or exercise. And how do you know if you are hitting your target? No expensive test needed, no special device. The most reliable indicator is the color of your urine. Very pale yellow, almost clear. Excellent. You are well hydrated. Completely colorless. You drank too fast and are flushing out important minerals before your body can use them. Slow down a little. Dark yellow or amber colored, warning sign. You are dehydrated. Drink water now, but slowly, in small sips. And to help you remember throughout the day, use the 3-bottle strategy. Get a reusable water bottle, 24 to 25 ounces, a simple plastic or aluminum one, and keep it somewhere you will see it constantly. First bottle, from the time you wake up until lunch. Second bottle, from lunch until mid-afternoon. Third bottle, until around 6 in the evening, so you are not getting up to use the bathroom in the middle of the night. Keeping the bottle in plain sight works as a quiet, constant reminder. You see it, you drink. No app required, no alarm needed. That simple. And we are almost at the end. But first, I need to tell you about 2 liquid villains that many people never suspect are sabotaging their blood sugar. And one of them is considered perfectly healthy by most people. Villain number 1, soda, including diet and zero sugar versions. Most people already know that regular soda is a problem. The sugar content is staggering, enough to spike blood glucose fast and hard, like throwing gasoline on a fire. But diet soda or zero sugar soda, many people assume it is harmless. And here is the surprise. The phosphorus found in most diet sodas competes with magnesium in your body, that essential mineral we talked about earlier. When you drink diet soda, the phosphorus blocks part of your magnesium absorption, and without enough magnesium, insulin struggles to do its job. On top of that, more recent studies show that artificial sweeteners can disrupt the gut microbiome, that community of beneficial bacteria living in your intestine that plays an important role in regulating blood sugar. If you want something flavorful and refreshing, the best option is plain sparkling water, no added sugar, no artificial flavoring, with slices of lemon, fresh mint leaves, or a small piece of ginger. It is refreshing, it does not interfere with blood sugar, and it actually supports digestion. Villain number 2, coffee on an empty stomach. I am not asking you to give up coffee. I would never do that. I have my own cup every single day, and I completely understand that for many people, that morning coffee is a comfort, a ritual, a small joy. But drinking coffee as the very first thing in the morning, before any water, is a quiet strategic mistake. Here is why. Caffeine consumed on an empty stomach stimulates the adrenal glands and raises morning cortisol, that stress hormone. And cortisol tells the liver to release stored glucose into the blood. The result, you have not eaten a thing yet, but your blood sugar has already gone up. The fix is straightforward. First, your warm glass of water with the tiny pinch of salt. Then, your coffee, with all the pleasure in the world. The order changes everything, and you do not have to give up your coffee. You just need to let the water go first. A 2-minute habit that could change the number on your next blood test. We have reached the end, and I want to leave everything clear and easy for you. Because I know that sometimes we hear a lot of information, and it can feel overwhelming. So here is your practical summary. Everything you can start doing today. When you wake up, before anything else, drink 10 to 12 ounces of warm water with a tiny pinch of unrefined sea salt. That is your metabolic activation ritual. Coffee comes after. 15 minutes before each meal, A small 5-ounce glass of water at room temperature. That smooths the entry of sugar into your bloodstream. During any physical activity, small sips every 15 minutes. If you like, add a pinch of cinnamon to your bottle. Before bed, 8 ounces of warm water, about 20 minutes before lying down. Talk to your doctor about magnesium. Throughout the day, use the formula. Body weight in pounds multiplied by 0.5 equals ounces per day. Spread it across 3 bottles. Use urine color as your guide. Avoid soda, including diet versions. Coffee as the very first thing in the morning. None of this replaces the treatment your doctor has prescribed for you. This is a complement, a way of giving your body the conditions it needs to respond better to everything you are already doing. And whenever you plan to make any change to your routine, especially when it comes to supplements, please talk to your doctor first. I want to close with something I have been telling my patients for many years. You are not too old to get better. You did not arrive too late. Your body has a remarkable ability to respond when you give it the right conditions. And sometimes the most powerful condition is the most simple one. Health does not begin at the pharmacy. It begins in your kitchen, in the bottle you carry with you, in the glass you drink before your morning coffee. Every sip at the right moment is an act of love for yourself. If you made it all the way to the end, I have one heartfelt request. Share this video with someone you love who is struggling with blood sugar. A family member, a neighbor, a friend who you know is tired of seeing that number come back high without understanding why. This information could make a real difference in that person's life. In the next video, I am going to reveal the 5 foods that most people think are perfectly healthy, but that are quietly spiking blood sugar without anyone realizing it. It is information that is going to surprise you. Turn on the notification bell so you do not miss it. I am Dr. Santiago Garcia. Thank you so much for being here with me today. Take care of yourself. You deserve it.